So today session we will only discuss that how I should study and the people who have joined me in my course. Uh, some of them have joined. Okay, anyone want to share the experience who failed in last time, Dr. Sana? What do you think? Why did you fail? And who
Yes,
has
Assalamualaikum.
one chance? Yes.
Yes, Dr. Khizir, I attempted for three times, but I felt my preparation was not up to the mark because time was less. I all three attempted exam was only 2 to 3 months preparation. So I
Hmm.
think it was premature attempts. So that's I thought about that my weak point because
Oh,
all time I failed with 1 or 2 marks.
yeah. So most of the people fail by 1 or 2 mark. Either they fail badly.
Yeah.
They are
So yeah, so I think I should prepare well and at least get 130 above marks. Then I think I will be able to pass. Otherwise, if I targeted less, so it will be more chance to fail.
good, inshallah. So if anyone have watched my session, how to prepare for the American FCPS, anyone of you from the 17 doctor, anyone have you watched? You are in my different groups, and I have shared the, the videos how to prepare for the American FCPS. I have conducted my session. Who has watched? Anyone?
Dr. Gazar, I watched.
Okay, so this time you watch, either the previous time you watched it, but you observed what I have said in.
Yes,
And
you
how
told
many months you should give?
6 months.
6 months. So that the first thing that you mentioned about the time. That's why I said that you have watched my session how to prepare for American MBA.
Yes.
So at least you must give the 6 months. Okay. So 6 months and that with the dedication. And then I explained that how you should be well prepared for it. For the American primary, I usually say 3 months. There will be people who would say that I am one of them. Okay, I am one of them that who will say that I passed a American SPA. There will be many people, but I never say to my students that you can pass it in 2 to 3 months. Okay, I passed. Yeah, I passed it in 2.5 months. Yeah, I would say 2.5 months. But that was a different scenario. Okay. And the last month, in the last 40 days, I was preparing only the American exam. Okay. I got the leaves. We were four doctors. We got the leaves. We used to study in Ramzan. That was Ramzan from early 10 a.m. till Aftari, and then after Travi till 2 to 3 until you can say the Sari. So that's how our routine. We were studying 16 hours. If you are studying 16 hours a day, yes, you can pass in 3 months. Okay. But as with the jobs, with the family, with the kids, with other things, you must give the 6 months. Okay. That's the, you must not listen to everyone who say that I passed in 2 to 3 months. There would be a people. Yeah, everyone have different scenario. Okay, if someone is working in the emergency department, if someone is working in the medicine and he has passed already, like he is doing the training, he has passed MM, he has passed MRCP. So that's the different. He has a lot of knowledge. Okay. About the medicine, but he has to only focus on the resuscitation and only focus on the trauma. Okay, so anyone else want to share? Today, we are discussing that how you should study and how the people who have joined me, how we you want me to take this course, and I will tell you that how we conducted the previous courses. Okay, like the people who have joined me American Primary, they know me. How we conducted the American Primary. So this time I have changed the scenario of American Primary too. So that's why I want to also change the American SPA like that. Yeah, the American Family like put it into the discussion based and MCQ based instead of teaching theory, because I have taught theory, and most of the people don't join live session. Like no, I think you four people have joined out of from prep expert. There are, I think, 10 people, and 9 to 10. And from masters, there are also such people. So out of 15, only 4 to 5 joined. So that's the scenario with every session. Yeah, that's what I have mentioned in my previous session. Yeah, that if you are not attending the live session, you are not going to grab what in the recordings, what you are going to grab in the live session. Okay, so I have got disappointed from many people. They don't attend the live session. Okay, until 1 month before the exam, you will join the course. And you think that after joining the course you are going to pass it. You are never going to pass it. If the examiner, the person who have set the exam, he is going to teach you, and you are not going to attend the sessions, and you are not going to study yourself, you are never going to pass it. Either he is teaching you the same things which he has given in the exam. If you are not studying yourself, you are never going to pass it. Always remember, people will say that join this course, you are going to pass. But I say, there are many students, I have called one of them, if anyone can join, who have passed. About 8 people have passed from previous diet, out of 11 who attempted the exam. So one of them, he is also part of LGM. She joined because of me in the LGM, and she follows me. But I say she follows me. She asked me that should I join this course, and I also recommended that course. I was sharing the links, pre-links to in the groups. But she asked me, should I join him? I said, you can join him. You are open to join. But she passed it. But she was saying that I did not get a lot of benefit from that course. It was sufficient to join you. So if I have asked him, forbid her that don't join him, don't join that course. If he has failed, she would repent that if I have joined that course, I have passed. But that's why I don't forbid anyone. Join if you want to join anything, join it. But you have to study yourself. You have to follow at least how many revision you have to do, Dr. Sana? At least
Three, at least three.
three, at least three. Then you will be 70% pass. If you are going to have a four revision of the course, I am sure if there's no hard leg, you are 100% pass. Samiullah, he is my student. He passed in the first attempt, and he followed my advices. And I'm sure, inshallah, he is also going to pass the American OSCE whenever he will get the OSCE seat. He is not working, he is a part of LGM, London Global Emergency Medicine, and he also joined the London Global with my reference. And then he is following me. He passed the American Primary, he passed the American SPA. He is working as a rural health center. Okay. So there are no patient. I have also worked back in 2018, rural health center, and 19. So instead of that, he passed because I was smelling that he will pass. Dr. Amna will pass. Dr. Bedouin. Whenever I am conducting the session, I know who is going to pass. And there are some hard legs, but if you are going to revise the course 4 times, but how I mentioned that how you should study, then you are never going to fail. Okay. Yeah, there are hard legs, 5% chances, 1 to 5% that you can fail if you are confused on the day of exam. There are some disruption. One of my student, he failed, I think last this time or last time. I think there was an internet error. He was very worried during the center, so that's why he failed with the margin, because internet got disconnected and they did not give extra time. So that's the mishap can happen. But if you are going to revise 4 times, you are never going to fail. So that's why who have joined me. So what I am planning. So first of all, I will share you the same how to prepare. Uh, I have conducted many times session. Okay, Dr. Sami, you want to say something? How did you found the course and it was helpful for you, Dr. Samiullah?
Assalamu alaikum, sir.
Walaikum salam.
Am I audible, sir?
If you can come on video. If not, if you are not in a feasible location, then it's okay. You can only speak. It's on. Yeah, yeah, you are audible. You are audible. You can speak. I was saying that if you can come on the video, that would be good. If you are.
Sir, sir, video will not be possible
Okay, okay.
outside.
Go on. Go on.
Yes, sir. I think I joined your course on March 2025 long course. Hello.
Yeah, yeah, you are audible. Go on. I mean, you are audible. You are mute now. I don't know why. You can unmute your. Are you here, Sami? Okay, he disconnected. No problem. Whenever it's fine. Okay. Can you see my presentation? I am also unable to. Yeah. Now you can see it. Okay, so the people who are going first time exam, there are 180 MCQs. Okay, so you will get the 4 hours, 2 hours. Paper one, paper two, there will be mixed paper. Okay, so there's not that in paper one you will get the trauma, not like that. You will get the 90 MCQs in the paper one, and then you will get the 1 hour break, and then you will get the 90 MCQs. No, the locations have changed. There's a view center. What is the new name of the center? So, so before going to exam, you must know what is the center. Okay, we have already attempted. So the people who fail, either they get the 110 marks, either they will get the less than 90 marks. Okay, there will be few people who will get the 100 plus. Either they badly failed, either they failed on the margin. Okay, so now the center name is surpass. So that's what. Thank you, Chiza. So that's the. And I am also going for the FCPS MSc, so I should also know about it. So new center name is surpass. Okay, so the other thing, these are, yeah, this is the exam date, 28 October. I'm right? No, exam is on yeah, September. Application 10 June to 17 June. Result is on 28 October. It's on 1st September, 16 September. Right? So there are SLO1, okay, history question, SLO3. The most difficult thing, what do you think, who are going for the first time, either like I am also going for the FRCAM exam, I am feeling that difficulty, okay? From last 2 to 3 months, I am gathering the people, I have made a group, I'm trying to study with them. So what is the difficult thing for any exam?
Dr. Khizir, I think this will be the most difficult thing to revise all the syllabus in last moment, like main points. We If we will go through in last revision is most difficult point.
Yeah, you are right, Dr. Sana. It can be the one, but most difficult thing is to take a start, to start the engine. Okay.
Yes, and
The
get
most difficult
motivated till
thing
end.
is to take
Yes,
a lot of months to start the engine. Okay. To make a tempo, to make a routine. That's a very difficult. Okay. And it
yes,
will waste your, you can ask me. I am starting to give the exam. I wanted to give the exam in last December. Then no, in this due to many reason, I am not going for the FRCAM SC exam. Although I am teaching you, I have many people who say that you can easily pass the exam FRCAM SBA. But I am teaching and I have a refresher knowledge. But the most problem is that I am unable to start the preparation. Okay. So, like the people many people who are clueless. I was because there is no one who can guide me. When we were preparing for the American primaries, literally I would say there was no one who could guide us. We were the only we. You can see that I have made a 1,000 MCQ points a recall. You can say so from the previous. I don't know where we get the file that we struggle a lot. So like that for the American SBA, there was no one, and so there was no one who could guide us for the American SBA. So that's why I started late, and I still remember there was only 75 days, and we started. And in starting, we also wasted 4 to 5 days. We were 4 friends, 4 to 5 friends. So that's very. But nowadays we are here to guide you how you should start. Okay. So that's a blessing for you that we can guide you and you can start, you can listen our sessions. After that, you start it. So for African SBA, I will appear in the African SBA, then we can also guide you for the African SBA. Okay. So there are many courses. People are connected from the India, people connected from the Sudan, Egypt, but they don't guide you that how to start the preparation. That's very important. Okay. So they will not motivate you. That's very important. Like Sami have texted. So Sami has texted in the group. The most thing is like that I say my mentor is Dr. Ash. So whenever I feel difficulty in giving exam everywhere, in starting my job, in my interview, so I always contact him. I always Dr. Ali, there's a consultant who is also faculty member of London Global Emergency Medicine. I contact him. I contact with Dr. Ash. They are my motivator. They motivate me to get the exam, to don't get the exam, when to. So that's you must have a proper guidance. That's very important. Okay. So today's session, I will teach you. Don't worry, a little bit 2 to 3 topics I will teach you, and I will also discuss how we can study. For the persons who are going first time, like my students Abdullah, Rabit, Sarvanti, there are many people who are going first time. I know them, so they must know that how to start the preparation. Okay, Dr. Maya. So SLO1, there you can see there are how many topics? 20 topics. Most of the people from you, they will start from the SLO1. Okay. So they will start from the SLO1. What will happen? They will waste a lot of energy on the SLO1. Although you are going to get only 60 MCQs. But I mentioned in my session which topic you must focus. This one. And where is the I? Cardiology. Yeah, cardiology is important. Okay. In the exam, you will note that you will get lot of MCQs from these topics, which I am highlighting. Okay. Parametry. Where is the GIT? And IENT, GIT. Okay. So you will get a lot of MCQs from here. These out of these 22. Although you will get 1 to 2 MCQs from others, But from these, you will get at least 2 to 4 MCQs. So that's how these 6 topics are very important. You will get more than 20. Exam at the post graduation level, they are all about the smart fit. You have to smart. So SEM speed the emergency. So most of the time you will get a material file in the exam. So you must from part of 10 where you should study from the Oxford. Okay. Oxford plus file which are given in our notes, either the expert file or whatever the PDF is available. Okay. So the other thing is the topics which I have mentioned, highlighted. So you will get one MCQ of the cardiology from here, ENT peds, ENT here, peds gastrology here, and peds eye patient. You will get definitely from. Okay, so these are very from urology. Most of the time, blue dot sign and these emergencies that come also. Okay, so that's why you must focus on. There are 25 MCQs. So totally, it's mentioned that all clinical spaces can categorize as applicable. All the clinical space label, either SLO 1, 2, 3, 4, whatever it is. If it is a pediatric age, that will be concluded in this 25 MCQ. Okay. Resuscitation, that's where you can see there are 40 MCQs. So in my previous exam, I focused on the resuscitation. So most of the people say that you will not get a lot of MCQs, but you will get a lot of MCQs from the trauma and resuscitation. There are 70 MCQs. So resuscitation, there are a few changes in the resuscitation. So that's where in my sessions, I have recorded all of the resuscitation in detail. So in my new sessions, I will conduct a session on the changes, what the changes have been done in the 20 research council guidelines. Okay. Trauma, orthopedic trauma, and major trauma. You will get the 30 questions. Procedure skills, you can see there are 10. Advanced airway, chest drain, external pacing, fracture dislocation, lumbar puncture, pain isolation, focus, vascular access, wound management. So all of that you will get one MCQ from each. Okay. So that's how from procedure skill you will get. Then the SL7. Don't waste time on SL7 for first 5 months. Only give 2 revisions in the last month. Okay. Whatever you are going to learn from it, you are going to forget it. Okay. So you must focus on which syllabus. I have mentioned, Dr. Sana, if you have watched it. Recently, I also uploaded the video. I mentioned that what topics you must focus on.
There's research and trauma.
Yeah, research, trauma, and the 6 topics I mentioned.
Yeah, in
One,
FL from
cardiology,
SL1
ENT,
cardiology, ENT, GI, and
GI,
respiratory. No, I yes,
and then the PEDS.
yes.
So you are going to cover procedure skill is very little one. What I teach in my session, that's enough. Other than the wound management, I think I did not teach in my session. So cardiology, IENT 6 topics, 5 or 6 topics are these 1, 2, 3, and 4, 5. Okay. So you will get 20 from here. Okay. 20 from here and PEDS 25. So out of 25, you will get at least 20 if you will teach PEDS and the 5 to 6 topics that I have mentioned. 20, 20 plus 40, and then 40 here, 80, and then 30, 110, and then 10%. So you are going to cover 120 for first 3 months. So you must focus on these topics. Okay. So what I give the plan that if you, that's what I am going to also do it in my this session. So what we are going to do, 4 days, you must do the resuscitation trauma and pediatric emergency and these 4 topics, and 2 days other topics. So they are either the 5 days. Okay. So that's how you can carry on the syllabus. Like 2 days, you will give to the cardiology, whatever allergy or every other session. Okay. And the other thing, 4 to 5 days, you must do the The most important thing is that you have to revise the course 4 to 5 times. That was 90 days plan session I conducted. Okay. So, but so that's why you must revise the course. First revision in how many months? 3 months. So before March, April, May. So till 30th May or at least 15th June, you must have revised all of the course of the MRCEM SPS. So if you have revised all of the course, then you must book the exam because exam is bookings will start from 10 June. So that should be your target. Okay. If you have revised about the 80%, then you should book it. Either you should not book it. That's what I am going to tell today. And this is the recording, and I will tell you who are revised about the 80% of course till 10 June, they are going to pass it. Okay, so that should be your strategy. And the next 90 days, then again you are going to that's what other thing I forget about the toxicology. Okay, sixth topic. I was thinking that what is the sixth topic? This topic is toxicology. Okay, so toxicology. Okay, toxicology. Oh, that was not here. So that's yeah, this is pharmacology. So these six topics. Okay, so that's what. And other thing is that the people who have joined me. So what I was thinking that I will give you a target. Okay, like I would say, if I am, we have a recording for upper limb, lower limb, everything. Okay, if I say that you must go through the recordings and then I can discuss the MCQs based session. What do you say? Like I would say that from today you must do the upper limb trauma in 3 days, and on fourth day I am going to conduct a MCQs based session. And this target, that's how I will give you the target, and then we will follow that target, and we will discuss about 10 to 15 MCQs in 1 hour of that topic. What do you say? It's a good idea. You must also do the MCQs from American Success. So you will get the PDFs of all the prep expert. Don't need to buy anything. Please don't waste money on that courses. Okay. So you will get all of that. You all know you have got the access of the material. So you have all the PDF file. You don't waste the money on that. For American primary, I say get the access for 2 months, 3 months because you are doing first time and you don't know how to solve the online MCQ. So that's why I say that please get the access along with my course. But no, I don't mention. I think Dr. Sami, he did not get any access, and Dr. Amna, she also did not get any. So that's how you don't need it. You will get all the quizzes and everything. If there are new quizzes, I will get you for you. Don't worry. You can get it for you, and we can do. So we are also collecting the past, I think, whatever the topics. And other thing that the important thing I forget to mention, you must focus on the past topics. Okay, not the past MCQs. That was so. What is the conclusion for today? Anyone can say what you have got from today. Dr. Sajid, you are not part of our, but you can give what you think. I hope you all must pass. Dr. Sajid, I think he is from Multan working in Mr. He is in contact with me from last 1 year. Are you here, Dr. Sajid? Yeah. Did you appear in the exam this time?
Hello, Dr. Khizir. Yes, I appeared in my exam, and
Okay.
unfortunately,
How many marks did you get?
unfortunately, I couldn't. I got 92.
92. So that's mean you are not nearly prepared. Okay. So other thing that you
Mm,
must prepare from zero. Okay. That's my advice for you.
I'm
So you
That
must
is why
prepare.
I am here.
Okay,
I
so
would
other
like to,
thing that the people who, I think one of the people who failed from my last course with 1 mark, I gave only one advice to him that this is not a 1 mark. One means zero. If you are failed, I knew I got a supply in my second year or first year from only the 2 marks, 48 in the Viva. Okay. So that means 40, 50 mean you have got the 100 marks, and 49 mean you have got the 0 marks. So that's the same scenario with the any exam. If you the passing marks of 120 this time, if you have got the 120, you have got 180. You are passed. No one is going to ask how many marks did you get. If you have got the 119, you are failed. You have to prepare from the zero. That's the my typical advice for you and the most important one. Revise the course 3 to 4 times. Go through the theory. Make concept. When you are preparing for the exam, think that how the question I can ask if I want to fail anyone. That's how you must prepare. Okay. It's like that. I always mention to my students whenever you are reading, like if you are reading this one, clavicle fracture, so you must think that when you are going through this slide, you must think that if I am the examiner, I am going to prepare the exam. How difficult question I can get from here, I can fail the student. So that's how you are going to make your own question, and you are going to think critically and how the question can be asked, how I can answer, how I can fail the student. So that's the typical thing. You have to finish the course first revision till 15 June. Write it. I will share in the group the people who have joined me. So first thing that if you have failed, you must start from zero. Okay. And today you must start preparation today. If you are going to start preparation today, tonight, now, right now, you are going to pass. You have to finish first revision until 10th to 15 June before booking the exam. The other thing that you must focus on the topics which I have mentioned is station, trauma, procedure skills, speed emergency, and the 6 topics. That should be your main focus. Other, you must also go through that. 5 days you must study these topics. 2 days other one topic. One topic other days. So other thing that is whenever you are going through any topic like upper limb. So what are the common topics? You know that the common topic is uh, like anterior shoulder dislocation, posterior shoulder dislocation. Okay. So you must go through these topics, not the past MCQs. So these are the common topics. Proximal humerus fracture, what a rotator cuff injury, very common topics. So that's how you must go through. Any question? Okay, so this is the theoretical session. I have conducted 2 to 3 sessions in my previous courses. So what I am going to do, I will give you the target and we will discuss them because that's like that. Okay, so I'm going to give a one example. So our first topic would be upper limb trauma. Which PDF, doctor? So we, so you can ask me. I think you all have my number. You can ask me any question. Okay, WhatsApp, anything. Other thing that's important. I am not saying. I got this habit from Dr. Ash that I'm always available. Okay. Sometimes I missed messages in between. I'm busy in the emergency department. I missed. So my chat GPT was listening AI, and he is also speaking with me. So that's the other thing is that I am always available. Okay. So that's what I would say. That's the Sunnah of Hazrat Muhammad Islam. Okay. So he was always available to his Sahaba for guidance, for help and support. So I always follow that. I am always available to anyone. If you text me, I reply. It can be delayed, it can be later on, but please text whatever you have query. I will reply you. I will guide you. I will support you. If you are demotivated, you can ask me any question. If you are not a part of my course, no problem. Instead of that, I will support you. Okay, I will guide you, whatever you want. And you all have my number. I think from where you got the links that you have my number. Okay, so uh, what you can see in this X-ray. So that's mean when you are going to attempt the question, a 20-year-old male presented to the ED with right shoulder pain, his arm is internally rotated and adducted X-ray is given. Whenever you will look on the X-ray, whatever comes into your mind. Yeah, that's what I will explain in my session. Okay, whenever I'm teaching. So you can give in the chat box, Dr. Ahmed. So what you can see, so that's what I am going to explain, Dr. Sana. Okay, the tricky question, whatever you are asking, I have explained in my previous sessions, in my how to prepare SBA and my whenever I am teaching, I am telling that how the question can be asked, how it can be difficult, how it can be tricky. Okay. So so you can what you can see, what is the sign you can see on this X-ray? Anyone else? So whenever you are attending the live session, you must be attentive and interactive. It can be wrong, no problem. Are you are you competing with Dr. Almas, Dr. Ahmed, Dr. Asad, Dr. Khizir? Are you competing with me? Are you competing with yourself? That's very important. Are you competing with yourself? You must compete with yourself, not the others. You have to pass the exam. You have not to get the top on the board or anything like that. You have no competition with anyone. You have to be competition with yourself. You have to only pass the exam. So you must be interactive. Is it wrong? Is it right? When I share the MCQs in the group, I have hired a person who will share MCQs on daily basis in my WhatsApp groups, on my Facebook. So that's but I got zero response. So that's why I stopped sharing. Okay. So that's the light bulb sign, light bulb sign, light bulb sign. So that's how you all know that this is a light bulb sign. Posterior shoulder dislocation. Whenever you will go to the option, you will be disappointed. So they have not asked about that. It's a posterior shoulder dislocation. What is the diagnosis? So that would happen in the exam. Right, Dr. Sana? So question is how the question is asked. That's the different story. So you have diagnosed right. You know it's a posterior, but in the question they will not ask about posterior. So they have asked what the question? What function he can do? He is unable to touch the contralateral shoulder. He is unable to internally rotate the arm. He is unable to adduct the arm. We need urgently refer the patient to orthopedic. He is unable to externally rotate the arm. Okay, what is your answer? Okay, you all have answered E. If I say that, leave this X-ray, we delete it. Oh my God, what happened? I have delete all this line. How I can undo it? Anyone know? Okay, I stop sharing and okay, just wait, just wait. Don't save. Okay, don't. Yeah, not saved it. So again, Just give me a minute. Yeah, I have found it. Okay, so you can see, I think again. So I'd say that it's uh, it's not a anterior shoulder dislocation. It's a anterior. It's not a posterior. It was a posterior shoulder dislocation. So you all have answered that it's C. If it is the anterior shoulder dislocation on the X-ray, what would be your answer from all of these? So there can be 2 to 3 answer. Okay, from just remember. Yeah, A. It can be the A. It can be the B. Okay, so both of them. So that's what. So that's how you can see that although it was easy to diagnose and you were thinking that they will ask about the diagnosis, but in the question they have asked a different story. So that's how you must focus on everything. And also in the X exam, age is also very important for the different patients. So that's how he is unable to externally rotate the arm is internally rotated adducted. Okay, so that's what. So they can ask about how will you can manipulate, when you will refer it. So that's how the question can be asked. So palpitations, feeling breathless, felt fine until around 3 hours ago. When these symptoms started, she feel lethargic and become dizzy on standing. She has not significant past medical history, is not allergic to any medication. Vital signs are as follows. Oxygen saturation 96%, respiratory rate 20 breaths per minute, heart rate 220, blood pressure 108 over 65, temperature 36.5. Her initial ECG is shown below. So what you can see on the ECG? First, so it's VT, broad complex tachycardia, broad complex VT. So ventricle tachycardia. So first of all, what you will see for any patient with the tachycardia, what you will see, are the BP. Okay, stable or unstable. So you will see the stable or unstable. So it's a stable or unstable. First tell me. How you can see that it's unstable. Dr. Sana. What are the unstable light threatening features? So what is the difference between the dizziness, dizzy, become dizzy on steadying, and syncope? That's the main thing in this question. Is there any difference between the syncope and dizzy
Yes, Dr. Khizir, syncope means loss of consciousness is there sometimes for
for some type
patient.
of
Yeah.
and
And dizzy, yeah, I also confused in this because dizzy, I don't think so is instability, maybe not. There is no, in dizziness, there is no loss of consciousness.
ah,
And
so in dizziness there will be disturbed orientation, but there will be no loss of
yeah,
mind. So you will not
yes,
consider the life threatening. Okay,
yes, yes.
so he will be responsive in the
Yeah, during conversation communication, and we can,
yeah.
yes.
So in syncope, he will loss of consciousness. So, in the life-threatening features, there are 4 life-threatening features. What are that?
Shock, hypotensive, maybe shock,
Yeah,
and loss of
hypotension. What is
consciousness is
that?
there. And ROC is there, loss of consciousness.
Hmm. So there should be life-threatening features for syncope,
Hmm.
hypotension, chest pain, typical chest pain, MI. Okay,
Ischemic,
patient having
yes.
MI,
Any
and the fourth is heart failure.
acronym, yes.
Okay, so these are 4 levels. If anyone is there, then patient is having the unstable. That's we will call unstable SVT, unstable anything. Okay, 4 things you must remember. So now, what would the course of management? I have solved your question. If anyone was thinking that it's a shockable, you have already made MCQs wrong. Okay, so I have given you a clue that it's a okay. So before starting this question, I was going to say that if anyone is going to answer right, I'm going to give you a discount. But no one gave a right answer. So all of you are wrong. Have you ever read this one, this algorithm? Who has read this? Yes. Anyone else who has read this? I will share all these. No, you can also download the new one from the Research Council website. But there is no change in this. And no one have read it other than the Dr. Sana. So, okay, if you have, how I no, I think it's clear. So you can see that it was regular, broad complex, QRS complex. Okay. I think, okay. Yeah. So what's it written here? How will you treat it?
Yes, with a milder if it is
Average
regular
wrong.
and broad complexes.
After that, what's written?
Over
Is there
10 to
any written
16
900 mg? Is there written
No,
900
no, no, no.
written? No. So what's written? If ineffective, what will you do?
It can give synchronized DC shock up to 3 attempts.
Yeah. So all of
Yes.
you chose 300 mg injection 900 mg will be repeated of for 24 hours. Okay. So that was your mistake. So it's non-shockable rhythm. Patient has been given injection of adrenaline. Then after that, 3 shocks will be given. I have made this myself. I took the statement from someone else about statement, but I changed the option. So that's how they will get you confused in the exam. You will get a recall you have read somewhere. Whenever you will go through the option, they will change it. So read it carefully. Only follow the guideline for management, but you have to read RCAM learning. Okay. For management plan, you have to read RCAM learning. So you must know what is the definitive management. What I think I have also mentioned glossary in my session how to prepare MRCAM SPA. Dr. Sana, I also gone through the glossary where it is given a detailed from the RCAM that what is meant by definitive, what is mean by immediate treatment, what is the next what they are going to, what is the investigation that I
So,
have also.
Dr. Khizir, where it is it is available in our Chem Learning site glossary.
No, it's yeah, it's available on the. I will share it with you. Don't worry.
Okay,
I
okay.
will
Thank you
also
so much.
I will share in the group right now. If
Okay,
I forget, please let me know. I have already
okay, okay. Thank you.
my previous. So that's how. So many of you have read it many times. This algorithm you have gone through it, but you never focused like that. Okay. So read every lines carefully. So that's why resuscitation, they are focusing on the resuscitation. So you have to, if you don't know the resuscitation, if you don't know the trauma, you are going to kill the patient. Okay. So that's why they focused resuscitation in the OSCE, they focus resuscitation in the FRCAM, they focus resuscitation in the MRCAM exam. Okay. So that because you are going to join as a registrar, you are going to join as a senior position. So what's that? I think this is the last MCQ we're going to discuss, either 2 to 3 more, and then I will give you the target, and then we can go on to the next. Okay, so what you can see. Okay, so what you can see, blood fracture of orbit, teardrop sign on which side? Okay, so what's the answer?
Numbness over left side of the cheek, numbness over left lower teeth. So which nerve will be injured? Infraalveolar or infraorbital? Infraorbital. So does the where the infraorbital lies?
Dr. Khizir, supply the lower eyelid, cheek, and lateral nose and upper lip.
Good. So it supplies the lower teeth, upper lip, so why didn't choose the numbness over the left lower teeth?
Uh, no, Dr. Khizir, this is supply the upper lip, not lower teeth. This is basically the
Upper
branch
teeth.
of maxillary nerve, yeah, trigeminal branch
It
of
will apply the
sensory
upper
innervation, yeah.
upper teeth,
Yes.
upper lip. Okay. So that's the question. Answer was A. Okay, so you must know which artery will be affected, and then you will, sorry, nerve will be affected, and then you will focus on the area. Next question. So can you give the explanation? Anyone can explain? Most of you are giving that it's electrolyte. Why do you think that?
And this patient is taking paroxetine and levothyroxine. So most probably it's an adrenal insufficiency. So we will check serum cortisol levels.
Why? Which drug cause the renal insufficiency?
SSRIs and levothyroxine both can cause. Paroxetine is an SSRI.
Okay, do you think that it's the most useful in investigation? Cortisol. Do we do in the emergency cortisol level? When we have to do the cortisol level and it can be beneficial.
And we can do
Doctor,
ECG also.
patient vitally stable, so we should not think
Yeah,
about the
there
shock.
is no real insufficiency. Excellent. Who is that?
Dr. Sana.
Yeah, we should not think about the adrenal insufficiency. Patient is vitally stable. Sugar is normal. Okay, so in adrenal insufficiency, there can be renal crisis, hypoglycemia, shock. So that can be there. Yeah. Okay, vitally stable. So what type of thing?
SSRIs can also cause short QT. So in that case, we will
Yeah,
give
so
ECG.
it can cause the ventricular tachycardia. So, so that's what we must think about, and so we must go for the ECG, long QT syndrome. So that's how. So that's what we should do immediately. Use for ED investigation.
Dr. Khizir, yes, I want to add one thing for other colleagues because I am experienced one to attempting the exam. So they in always they are giving some distractors in the question.
Yeah,
So we should exclude that distractors and then focus to the question. Otherwise, these are the things I always faced and confused about it.
yeah. You it can also confuse and weakness. Okay, so that
Yeah.
can be hyponatremia. So that should be
Yes.
uh with the
And
VBG.
always, yeah, I what I've faced, I always exclude the options, but I always stuck last two things which I always felt both are correct. So which one should be the most accurate according to the emergency? Because like you made this question, what is the first specific asking about the emergency investigation. So electrolyte is also okay because hyponatremia is the cause, and but we have to focus which is the best immediate investigation. Like we all focus electrolyte is the correct answer, but ECG is the correct answer.
Either if it was BBG, then we can go for it. Okay, so in the ED investigation and the urgent, what you can get. Electrolytes, how much time electrolytes take? So whenever patient is in the uh, emergency department, you what first thing what you do? ABCD assessment. Okay, ABCD. And when during the ABCD, if you think you want to do so on the bedside, you can check the glucose, you can do the ECG. That's what you can do. You can do the VBG. These are bedside and urine. Okay, so these are the bedside and quick investigation what you can do in an emergency patient. So that's a very common question in the exam. In every exam, you will get it. Okay. So what you can see? So that's the penetrating global picture, and very easy. It's a very common question. Okay. Okay, so I have also discussed these questions. Okay, so that's how we will discuss the MCQs. Okay, and I will give you the target, and we will discuss that. So that's what I'm going to plan for every system, and I will give you target, and as per our target, we are going to finish the syllabus till 10th June or 15 maximum 15 June, and then we will have a then you can book it. So I will be in UK from next month. So it will also Dr. Ibrahim will also teach with me. I'm going to also align someone else, one other tutor with me to teach you MCQ based, and you can also go through all of my session, previous session, MCQs, I theory and everything we have. And if I will be UK, so it will be difficult for me to align with the timetable. So whenever I will be having off, so I can take a session. Either I will be available on Saturday and Sunday. So that's how we can plan the session, a long session. So any question, anything you want to suggest that how we can start, you can also give the suggestion of the group, inbox me. I'm always open to discuss. So the people who want to join me, you can text me on my WhatsApp. So we are already joined. Okay. So we will also give you the resources. Like which can show you. We will get you all of the book. Yeah, these are recordings, these are resources. Okay. That's what we will give you all of the recording, quiz, everything is available there. Awards. Okay, thank you very much.